Malaysia will start vaccinating children between 5 and 11 years old against COVID-19 next month. We speak to University Kebangsaan Malaysia's Dr. Sharifa Ezat on how best to prepare children and parents for their vaccinations.
If they come to the PPV for vaccines, I think it's very important for us not only to prepare the parents. That means that we need to tell the parents, this might happen to your children, and what to do if they have adverse events. Things that if they are having prolonged fever, they need to come back and get healthcare help, and be seen by a doctor. If they have shortness of breath or extreme difficulty in breathing, what should we do and where to bring. On the guidelines, this should be prepared before the children are actually seen and be vaccinated. That means the government should have a proper guideline on how to manage the cases, but also to prepare the doctors and also the healthcare system, in case these children actually are being seen by them. We don't want someone who are having some complications or adverse events, and then when they are being seen by someone in the healthcare, these people or the doctors or basically the healthcare do not know how to manage the children. So these are something which is worrying, and we need to prepare both sides, not only the parents that you need to come for the vaccines, but also the healthcare system.
Meanwhile, she said the reduced quarantine period of 5 days for returning travelers boosted with the COVID-19 vaccine is sufficient, as she called on the public to get their booster jabs.
I think this is fair because even though not many are boosted in Malaysia, it is increasing, but the coverage is still can be improved. The 2 days lapse between boosted and also only the primary dose is considered time that you suppose that you don't get being a carrier anymore. So 5 days is considered enough, and it is not only the days. You're supposed to be negative when you test your second testing, and also on the 5th and also the last days you're supposed to be negative. So I think this is considered sufficient, and hopefully that we don't get any more carriers after quarantine as well.